Are you confused about which sunscreen to use? Do you know what SPF number to choose? I'm becoming a poet. Are you still squeezing out the last drops from the bottle that you bought 3 summers ago? Let's clear up the confusion. What's really in your sunscreen? How often to use it? And which type is the best for you? Because the truth is, your skin remembers every sunburn, even the ones that you forgot. But first, welcome back. I'm Dr. Maria Azizian, a board-certified general surgeon and an IFM-certified functional medicine physician. On this channel, I share health tips on skin health, food and supplements, functional medicine, surgery, and the latest medical research to help you feel your best. And if that sounds good, please like, share with your friends, and subscribe. Let's start with a common question. Do sunscreens expire? Yes, they do. Most sunscreens are good for about 3 years. But high heat, like leaving them in your car or a beach bag, can break down their active ingredients much faster. So if it smells strange, has separated, or looks off in texture, just toss it. Expired sunscreen won't protect your skin and could even cause irritation. So in reality, I recommend throwing the old sunscreen from the last summer and buying a new one. It's actually easier to go from summer to summer in purchasing the sunscreen. Before we discuss the types of sunscreen, let's talk SPF. It stands for Sun Protection Factor. The number tells you how much longer you can stay in the sun without burning compared to no sunscreen at all. So if you'd normally burn in 10 minutes, SPF 30 means you are protected for 30 times, about 300 minutes in theory. But here's the important thing about SPF. It only protects against UVB rays that cause sunburn. It doesn't tell you anything about UVA rays. UVA rays are very important as they cause aging and deeper skin damage. And that's why you need broad spectrum sunscreen, the one that protects you from both UVA and UVB rays. And think of it as full coverage, like no burning, no premature wrinkles. Now let's look at the type of sunscreens. There are 3 main types of sunscreens: mineral, chemical, and what most people think of as regular, which is a blend of both. Let's start with mineral sunscreens. These are also called physical blockers, and they use ingredients like zinc oxide and titanium dioxide. They sit on the surface of the skin and reflect UV rays. I recommend mineral sunscreens for people with sensitive skin, or anybody who's reported a rash or itching or symptoms from regular sunscreen. And it makes sense that sunscreen for babies are essentially mineral sunscreens, and they only have 2 ingredients. And sometimes, just to make it easy for my patients who may be confused about how to find a mineral sunscreen, I just recommend that they use a baby sunscreen. Other good things about mineral sunscreens are that they work immediately and that they are broad spectrum, meaning again that they protect against both UVA and UVB rays. Downside, some still leave this white pasty cast, though the newer tinted versions are better. The next group of sunscreen is chemical sunscreens, and these absorb UV rays and convert them into heat. Common ingredients include avobenzone, oxybenzone, actinoxate, and octocrylene. They are more lightweight and cosmetically elegant, but they need to be applied 15 to 30 minutes before sun exposure. People with sensitive or reactive skin should avoid them. And actually, not only those people, but more about it in a minute. Then there's a third group of sunscreen, which is combination of regular sunscreens, and they blend both mineral and chemical ingredients to balance protection with ease of use. Now, let's discuss hidden risks, including carcinogenic concerns with sunscreens. This applies to chemical and combination sunscreens and essentially doesn't apply to mineral sunscreens. Some chemical ingredients like oxybenzone have raised concerns about potential hormone disruption. And more alarmingly, independent testing has found contamination with benzene. It's a known carcinogen and actually present in some aerosol sunscreens. And benzene isn't added on purpose. It's actually a byproduct from the manufacturing process. Interestingly, ingredients like oxybenzone and actinoxate have been banned in places like Hawaii, for their potential environmental impact, especially on coral reefs. So if it's not good for coral reefs, why should we humans use it? The official recommendation is to continue using chemical sunscreen, as the risk of skin cancer from UV exposure is far higher and well established. I personally think that it is the best to stick with mineral sunscreens that contain, again, titanium and zinc only. When we're dealing with chemical sunscreens, we need to worry not only about the actual ingredients, but also about the contaminants. And we also need to remember that chemical sunscreens are absorbed systemically, meaning into our whole body. And just like many toxins and contaminants in our food and environment, I think that there's so much we don't know about absorption and effects of chemical sunscreens that it's just the best to stick with the mineral ones. Also, it is smart to check your labels. Avoid aerosol sprays when possible and choose trusted brands that test for contaminants like those rated by EWG or Think Dirty. What are those? EWG is Environmental Working Group, a nonprofit that evaluates product safety based on scientific data. And Think Dirty is a mobile app that just ranks personal care products by their potential toxicity and ingredient transparency. Our next question is how often to apply and just seasonal tips about sunscreens. And here's the truth. Most people underuse sunscreen and they rarely reapply it properly. You need about a shot glass worth or 1 ounce for full body coverage, and you should reapply every 1.5 to 2 hours, especially if you are sweating or swimming. In the warmer months, apply sunscreen to all exposed areas: face, neck, arms, legs, ears, hands, feet, everything that sees the sun. In winter, you still need sunscreen on your face every day. UV rays can still penetrate clouds, reflect off snow, and even pass through the windows. So if you care about aging, pigmentation, and skin cancer prevention, daily face sunscreen is non-negotiable. And remember, makeup with SPF is not enough on its own. It's essentially useless as it contains very little sunscreen and you still need proper sunscreen underneath. And don't forget, reapplication throughout the day is extremely important if you're outdoors. So what should you buy? To avoid chemicals and potential carcinogens, look for broad spectrum sunscreen with SPF at least 30 that protects you against both UVA, aging, and UVB burning rays. Mineral sunscreens are safer. And here's the interesting fact. Increasing SPF beyond 30 offers only marginal extra protection. Just to demonstrate, SPF 30 blocks about 97% of UVB, and SPF 50 is 98%. So don't go after the SPF. Instead, focus on how well and how often you apply, and most importantly, reapply. In my experience, I noticed that a lot of people are diligent with applying sunscreen once a day, but then they forget to reapply. That's why reapplying is extremely important. I hope you enjoyed this video. I'm looking forward to reading your comments. Thank you so much for watching. Until next time. Bye-bye.